Good afternoon, everyone. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels. We're getting back to the mini-series in regards to Medicaid and exactly what we are looking at in regards to how devastating the cuts being proposed by the GOP Republicans right now is going to be to millions and millions of people. Right now, what we have been going over is in regards to the current workforce shortage in regards to people who are considered more direct care staff. We're talking individuals who deal with more medically fragile folks, people who need assistance with bathing, getting dressed, getting shoes, being able to eat, all of that, as well as a few other areas that it happens to touch as well. We are going to be going into the job programs and vocational rehabilitation and how those cuts could possibly affect those programs, which very obviously the GOP either doesn't realize or doesn't care, because while they want to mandate work, at the same time, they want to remove funding from the very programs that assist in helping those of us who are developmentally disabled or otherwise disabled obtain employment out in our communities. But that's going to be its own topic within the series, which is probably no longer going to be a mini-series by the time we're all done with it all. So, let me go ahead and get back to where we were. But first, we're going to go through the disclaimer/trigger warnings. Alright, folks, as always, you are going to see the link to this particular article right there in the description box, as well as the links to all the information we have already gone through in regards to Medicaid and what these cuts are exactly putting at risk in regards to programs for those who are developmentally disabled, physically disabled, elderly, what have you. Now, that being said, I do have the channel, always marked not for kids, for a reason, because I use profanity pretty much prolifically. I can't help it. It's usually about every other word out of my mouth. So, if you are, or if a child is watching, 16 and younger, parental supervision is very much advised, alright? Okay, so, where we left off. How much do states pay for Medicaid home care? KFF asked states to report their average hourly rate paid to two types of home care provider agencies: personal care agencies and home health agencies, and three types of specific home care providers: personal care providers, home health aides, and registered nurses. Now, personal care providers can come from places like ARC, like Easter Seals, and some of the other bigger providers out there. Out here, we also have Nova, Judavine, and Abilities First. That also covers in regards to case management as well, because as I told you yesterday, a lot of the case managers that were originally working out of the regional office here for the Missouri Department of Mental Health, Division of Developmental Disabilities, ended up after the major cut in the 2010s, going over into the providers and providing case management there. And yeah, it's gotten kind of confusing, especially when it comes to doing full functional behavioral assessments, having everybody there that needs to be there. But yeah. Now, home health aides can come from a variety of different types of providers. They may be coming in from ARC, but they also may be coming in from places like out here, the major ones called Oxford or Oxford Health. They handle those that require a lot more support physically. Maybe not those who are completely and utterly paraplegic, but those that do need assistance in regards to getting around out and about, getting food prepared, things of that nature. And then the registered nurses, now these are more specifically for some of our most medically fragile that we have out here. A lot of them come either from Oxford or they come through Cox or Mercy, which is our two main strains of direct medical care throughout the state of Missouri. I know some places have other ones out there, and the registered nurses in particular usually come from those areas. There are a few hospice providers out there that also provide the registered nurses. A lot of that tends to be more covered by Medicare as opposed to Medicaid. Let me go ahead and continue. But many states were unable to report all rates. The number of states that responded to the survey but did not provide payment rates or reported that payment rates were unknown was 4 for personal care agencies and 23 for home health agencies. Even more states did not provide payment rates for specific provider types. For registered nurses and home health aides, nearly half of the states did not provide payment rate information or reported that payment rates were unknown. Now, in some of these areas, in particular home health aides and registered nurses, these are usually more directly from pure medical health care providers, like the ones that I mentioned previously. And they are usually the ones that cover in regards to the area, the hourly wage, or if they're getting a salary, what have you. So that's probably why a lot of them didn't necessarily report anything in regards to that. And states like mine tend to have a lot more data in regards to job shortages and pay rates when it comes to places like ARC, like Nova, like Judavine and DCO and everybody than they do for those who are more straight medical health care. All right, let me go ahead and continue here. Starting July 2026, states are required to report detailed payment rates for personal care, home health, and other services per the provisions of the Biden administration Final Access Rule. In addition to reporting payment rates for certain home care services, starting in 2030, states must demonstrate that at least 80% of the payments went to compensation for providers, also described as direct care workers. So the main ones I've been telling you guys about for quite a while. Okay, this is in regards to because it's high stress, because there has been a fundamental and scary work shortage when it comes to people who are properly trained, who are to be out here being direct care workers. So I know that the Biden administration was looking at maybe what we can do to kind of ebb the flow of all these individuals who are going through this particular type of job and burning out quickly, so that we get more workers in, so that the ones that are still there are not so stretched thin and with an incentive to stay. Now, with what the Republicans are proposing, the way I expect that to go entirely in the opposite direction. I don't really have words to be able to adequately describe that, but yeah. 180 and even 360 doesn't cover it, is all I'm saying. Meeting the requirement will require states to know both agency and provider payment rates. Among the states that were able to report payment rates, 38 could report payment rates which would be required under the rule. Oh, sorry, I kind of read past that. For personal care agencies, home health agencies, personal care providers, and home health aides, all of which would be required under the rule. Those 38 states include states that reported a mix of hourly and non-hourly rates, which makes comparisons between provider and agency rates more complicated. The challenges highlight the difficulties states face as they implement the requirements in the new rule. Who knows how long that new rule is going to last, considering that Trump has a grudge and is therefore trying to eradicate every single thing that Biden did during the entirety of his presidency. Because, I don't know, narcissist gonna be a narcissist? Who cares who I screw over as long as I get revenge? Because I get myself in trouble, folks. I just know it now. Alright, now we're going to look at Box 1. This is Final Access Rules Provision on Home Care. On May 10th, 2024, the Biden administration released a full rule aimed at helping to ensure access to Medicaid services, which has several notable provisions aimed at increasing transparency and improving access to Medicaid home care, increasing home care payment rates, and addressing the home care workforce challenges to help ebb the flow of the burnout rate for our direct care staff. The rule cites workforce shortages as a major contributor to home care access barriers among Medicaid enrollees. Now, we're not just talking about those who already have services. We're talking about wait lists that go so far back. It's beyond insane, folks. The wait list back when I was coming into the service system, about 18, 19 years old, usually that list was already backed up by 3 years. 3 years. I got remarkably lucky because the person that was supposed to get my spot in the assisted living apartment that they had me go into right as I was transferring out of high school into transition services that would lead to adult services, somebody decided not to do it. I don't remember what the reasons were. But yeah, general time period for those wait lists was about around 3 years. What we're looking at as of right now, currently, before the cut's going through, is about 5 to 6 years. 5 to 6 years, folks. And that's not just for folks like me. That's also including those who require a lot more support than I ever did. Let me go ahead and continue here. Starting July 2026, states must report state hourly payment rates for personal care, homemaker services, home health aid services, and habilitation, and publish that information on the state website. If the state rates vary across provider types, geographies, or other factors, the states must report each of those rates. There's going to be some difficulty there because in regards to hourly rates, it really does depend on the type of direct care worker staff that we are talking about here. You're going to see a very dramatic difference between a community integrator, someone who works out of ARC for those folks who are more like me, and those that require a lot more support, as well as assistance in regards to funding for assistive devices. So, yeah, that's, if Trump doesn't overturn it, that's going to be a feat of engineering. Alright, let me continue here. For each type of payment rate, the disclosure must also include the number of Medicaid paid claims and the number of Medicaid enrollees who received the service within the calendar year. States must establish Interested Parties Advisory Group, or IPAG, comprised of direct care workers, Medicaid enrollees and their representatives, and other interested parties. The IPAG will meet at least every 2 years to advise and consult on the sufficiency of current and proposed payment rates for personal care, homemaker services, home health aid services, and habilitation. Now, when we're talking about homemaker services, again, this is in reference to those who are a lot more medically fragile, that require assistance with keeping their homes clean, everything sanitary and healthy. Starting to also habilitation in habilitation centers, There's a lot less of those than what used to exist, and that old state hospital out in Mount Vernon, there used to have a rehabilitation center that was on the grounds. A lot of Medicaid covers those services. I do remember a lot of those folks being older, although I do know that those go across the board. It's just that's not my particular area of expertise. That one would be more something to discuss with someone like my mom, who has worked in regards to a rehabilitation program previously before she began to go after her degree in radiology. Starting July 2030, states must ensure that at least 80% of payments to Medicaid providers for designated home care go directly to compensation for direct care workers, their hourly wages in particular. Most of the direct care workers out here, I've not met a salary direct care worker yet. Pretty much all of them are on hourly wages. And they have some type of compensation in regards to gas when taking the consumers to and fro in regards to getting things taken care of. Designated home care include personal care, homemaker services, home health aid services, and habilitation. States may adopt separate standards for small providers or exempt small providers that meet reasonable criteria. Small providers would be a lot more like DCO, or Developmental Center of the Ozarks. They work primarily with kids, anybody that's between the age of toddlerhood all the way up to about around 16 years old. Most of the work that is done there is done on the grounds, with the main difference being the workers that would take the kids to and from home or any extracurricular activities. Anytime after class teaching living skills, I'm pretty sure you get the drill there. Alright, let me go here. Beyond payment rates, the access rule includes other requirements aimed at increasing access to home care. Starting July 2027, states will be required to report the number of people on waiting lists for services, an average amount of time from when homemaker services, home health aid services, or personal care services are initially approved to when services begin, and the percentage of authorized hours that are provided. We are going to be going into more detail in regards to those waiting lists. That is going to weigh very, very heavily, and there's going to be some dire consequences in regards to those lists should this cut go through, and should they do exactly the $2.3 trillion over the next 10 years that Trump has demanded, because he's absolutely batshit insane. So, not sorry. Come at me. I don't care. I'm old, I'm cranky, and I have a whole lot of pent-up rage from being a call center worker. Come at me, bro. Create new requirements incident. Establish requirements for people to file grievances if they are receiving home care from state Medicaid program, and require states to report on nationally standardized quality measures. The home care payment-related requirements are one component of a broader emphasis on addressing Medicaid payment rates. The access rule also requires states to report for all fee-for-service Medicaid payment rates on state websites and to compare various service-specific rates to those of Medicare. A companion rule on the Medicaid managed care requires states to submit an annual payment analysis comparing managed care plans' payment rates to Medicare payment rates for selected services. So differences in payment and how that all works. Alright, let us continue here. I might be a little bit slow, folks. A lot of information to go over and way too little time. States reported many reasons why it was difficult to report payment rates, including the following. Some states reported that services were bundled together in various ways, and therefore the payment rates were not distinguishable. Among states with managed care, some states responded that they did not know the payment rates for agencies because the services were paid by managed care plans, and they did not have access to those payment rates. A lot of places like art do tend to decide themselves in regards to hourly wages, but in regards to that, it is heavily influenced in regards to Medicaid and what funding there is currently there that they have access to. Which, like I said, the 2010s cuts are still hurting us, which is why you'll see hourly wages for direct care staff starting out at about around $9.25. Just keep that in mind. Granted, that's my state, but it's still ridiculously low, folks. When you are a direct care worker and you've had detailed training and you're working within the field, and the McDonald's that you go to during breaks between consumers, and the person that's handing your food out to you from the drive-through window is making $3 higher per hour than you, there is something very, very wrong there. Just my opinion. Alright, let me continue here. Other states responded that they knew payment rates for agencies, but not what the agencies paid their home care workers. Multiple states reported they do not dictate what agencies pay. We already covered that. In addition to having difficulty reporting payment rates, many states reported different payment rates for personal care across different waivers. And waiver payment rates often differ from the payment rates of personal care provided through the state plan. When states reported multiple payment rates for personal care, KFF used the median of those payment rates in the analysis. The payment rates to home care providers show considerable variation and are somewhat higher than those reported by other organizations on account of differences in reporting and provider characterization. KFF surveys estimates that the median payment rates to providers are $18 an hour for personal care providers, $40 for home health aides, and $64 for registered nurses. In what state? No, for real, which state? I've got a lot of friends who could really use some hourly wages like that. Do we got some names? What state are these? Because they may want to move. I might want to move. Holy hell. Actually, I do want to move, but it's literally more along the lines of get me the hell out of this country. For the love of God. Sorry, not sorry. It's looking scary, folks. It's looking scarier and scarier all the time. It is difficult to compare those numbers to other sources of data for the following reasons. Other organizations group classes of providers together differently. PHI reports that in 2023, the median rate for home care workers was $16.13 per hour and $17.15 per hour for residential care aides. The Bureau of Labor Statistics reports $16.12 per hour for home health and personal care aides in 2023. Other organizations include payment rates for workers regardless of the source of payment, where KFF rates only reflect the Medicaid rates. Medicaid often covers the intensive personal care services that other payers, which may contribute to the higher rates. Alright, breathe with me, folks. Breathe with me. We're almost done with this particular area here. Payment rates to health... Oh, I'm sorry. Let me state that again. Payment rates to home health agencies are generally larger than those to personal care agencies, but there is considerable variation in both. Figure 4. Among states reporting hourly rates, the rates for home health agencies range from $25 to $154, whereas those for personal care agencies range from $14 to $176. Where are these states? Again, I have friends that are direct care support, people who are case managers. Where are these magical rates, folks? Because it doesn't look good in our GOP hell that is Missouri. Sorry. Those states reported that the median hourly payment to home health agencies was $62 and $25 for personal care agencies. Now, this is probably in regards to those I tell you guys are more medically fragile, need assistance with bathing, medicine, making sure their oxygen tanks and everything is working well. It's a little bit more engrossed. There is considerable variation in payment rates for Medicaid home care across states and provider types. Range of state hourly payment rates to agencies and providers in 2024 among states that reported time-based payment rates in equals 48. So, personal care agency, 44 states, home health agencies, 19, payments to providers, personal care providers, 34, home health aides, 20, registered nurses, 22 states. Now that's more for Medicaid. Medicare covers more of the cost out here in regards to home health aides and registered nurses, and less the folks that we're dealing with are a little bit more on the younger side, of which it usually goes to Medicaid funding. Among states able to report any payment rate data, payments for personal care workers range from below $10 to over $20 per hour, which is what I was just telling you about. That's why I want to know where those states are. I know a lot of people who probably wouldn't just think about seriously moving there and grabbing those jobs. Rates for home health aides are somewhat higher than those of personal care workers, reflecting the additional training requirements for such workers. Among the states with payment rates for home health aides in the highest category, some states reported that the rates were per visit per day, which is noted in Appendix Table 4. There were other states with particularly high payment rates that did not report providing rates per visit or per day, but the rates may still reflect a non-hourly payment basis. All right. Now, of course, they're saying here payment rates from home care may vary across states and type of provider, which we've already gone over that a little bit. All right. Now we're getting towards the meat of it, folks. How might the end of the enhanced federal funding affect payment rates for Medicaid home care? States received $37 billion in additional federal funding to expand Medicaid home care during the COVID-19 through Section 9817 of the America Rescue Plan Act, or ARPA. This provision increased the percentage of expenditures that the federal government paid by 10 percentage points for spending on Medicaid home care between April 1st, 2021 and March 31st, 2022. States were required to use the new funding to enhance, expand, or strengthen their home care program. Because remember, this was COVID. Everybody was pretty much locked up in our own homes. I'm autistic, not that I really minded. And it was a great, no, we're not going to make that kind of dark humor today, sorry. But yeah, there was a major escalation in regards to home care workers needed during COVID. That is definitely for sure, particularly in regards with those medically fragile, being able to get to and from appointments, being able to get their shots safely. Yeah, there was definitely a whole lot of stuff going on at the time. Most states will exhaust these funds by March 31st, 2025. Some states have received extensions through September 2026. In case you're wondering, no, that's not Missouri. We are stuck in Missouri GOP backwards redneck hell. Somebody please send help. I know I say that deadpan, but for the love of God, it's not deadpan in my head. It's more like, I don't know if you've ever seen Happy Gilmore where the lady jumps on the car and says, "Get me out of here." That's me right now. Barely holding on to composure, even with my meds. Alright, the number one use of ARPA funds, accounting for more than $30 billion in new funding, was for workforce recruitment, retention, and training. So, part of that Medicaid funding, folks, goes towards covering the costs for the training that these direct care workers receive, that your home health aides receive, to make sure that when they are taking care of their consumers, that they're not just some person wandering in off the street somewhere. They know their business. There was a long time, I know, because I had to deal with it, where you got some care workers, direct care staff, and community integrators. Let's just say the training was subpar, and I had to explain my own treatment program and the interventions that I was going to need and everything that should have been read by the full functional behavioral assessment that I went out of my way to make accessible to everyone. Eesh, folks. Eesh. So, a lot of us, by means of People First and ASAN and my own group that I was running at the time, kind of really campaigned in regards to making sure that there were better training requirements, even for community integrators. But training isn't free. So a lot of the funding for those trainings come through Medicaid and Medicaid waivers. You cut those funds, even if the direct care staff holds on there by their fingernails, you're still looking at far less access to meaningful and extremely important training. Alright, let me go ahead and continue here. The number one use of ARPA funds, accounting for more than $30 billion in new funding, was for workforce recruitment, retention, and training. As enhanced federal funding comes to an end, most states are hoping to keep their increased payment rates for home care providers. The clear top priority for states is preserving provider payment rates. 30 states. In comparison, far fewer states reported prioritizing other enhancements, with 16 states reporting that a top priority was added or expanded services, and 5 states, California, New Mexico, North Carolina, Oklahoma, and Texas, reporting that reducing or eliminating waiting lists for home care was a top priority. Those 5 states account for 55% of people on waiting lists. Arkansas, Delaware, and Washington reported providing family caregiver supports to be a priority to continue once funding depletes. Now, out here in Missouri, the waiting lists, even now, have never been the priority when it comes with our GOP government out here. At all. In fact, that's why waiting lists, instead of getting shorter, are just getting longer. And if we get those cuts, oh my God. Somebody send the comment. Humanity's had a good run. Sorry. Alright, states' top priorities for continuation after federal funds are exhausted. Increased provider payment rates. Now, this is in regards to what we currently have being exhausted. This is literally what we're talking about before the current cuts that the GOP is proposing take effect. This is right now. Keep that in your head. Increased provider payment rates 30. Added or expanded services 16. Workforce supports 9. Reducing eliminating waiting lists 5. Family caregiver supports 3. God, that's depressing to look at. Alright, folks, while many states would like to maintain enhancements made using additional federal funds, 5 states reported plans to eliminate provider payment increases after federal funds are exhausted. Connecticut, Maryland, New Jersey, Washington, and Wyoming reported such plans. And Arizona, Maine, and Nebraska also noted that they would be eliminating some type of additional payments to providers, but did not categorize the payments as provider payments in the KFF survey. So this, folks, is the current state in regards to direct care workers throughout the majority of the United States. And if it looks bleak, it's because it is. This is the current situation we are in right now as we speak. That funding is getting ready to run dry. And then we're looking at cuts far worse than the ones that we got impacted by back in the 2010s. You're talking about a lot of individuals that truly need more care and more supports that could be possibly left in the cold. And hell, those folks like me, we're just shit out of luck, folks. Granted, it's pretty much always that way, but in regards to something like this, you are going to be having situations where states are going to have to look at, once again, tightening up the criteria and cutting more people out in regards to those of us who will be able to receive those services, because even right now, there's just not enough money to be able to cover it all. So a lot more people are getting left out in the cold all the time, and there's no real infrastructure behind it to help at least cushion the blow. That's one of my major concerns in regards to all of this, especially in regards to the cuts. You have individuals who have no idea what exactly taking that much money out of a program like Medicaid is going to affect millions of people. Okay? They have no idea what they're doing. They usually don't. And then they're going to go off and tell you, like the GOP's been trying to say in the news, oh, the people who really need services will still get them. They need to be confronted with this. Put right in front of their eyeballs. Because I'm going to do it. I know people first, we're gearing up to do it. ARC, everybody. The people who want to make these cuts are individuals who know absolutely nothing about the service system. They do not know how the money is spent. They have no idea the services that it covers. They're taking a chainsaw into something that could, like, the whole thing could collapse. With no infrastructure for any of these folks to be able to fall back on. This could literally be catastrophic, folks. And even gigantic providers like ARC can only absorb so much of that. These are not services that are generally cheap if you're trying to pay them out of pocket. This is millions of people's lives on the line. And I'm sorry, this is not the time for politeness. This is not the time for decorum. You grab these people and you shove their faces into things like this. Make it real for them. Because if we can't, God help us all. Now, I'm going to go ahead this time and include a link to the ARC website for you all. And what I would like you all to do as your homework is to use their resources to reach out to your representatives. If you send emails, send links to articles like this. If you do phone calls, send it to them that way. Get a hold of them. Make what is staring us in the face real for them. Because if you do not, yeah. Alright, folks. So, you got your to-do list. Get a hold of your representatives. Use the email templates on the ARC website if that works a little bit easier for you. Reach out by other ways. ARC is also a non-for-profit. If there's anything you could do in regards to donations, or just sharing their website. I know that they would appreciate it. You can also go to the People First website and donate with them, or Adapt, Impact, ABSI, Judavine, Abilities First, the Centers for Independent Living. I know that they would definitely appreciate it. We're going to go ahead and close out on that one, folks. We don't get very many views on this channel, and the few we do get do tend to get removed from time to time. So please don't forget to hit the like button, hit subscribe. Don't forget to utilize the comments. I do appreciate your time. As always, folks, we here at Spilling Tea hope you have a good one. We'll see you all later. Bye-bye, everyone.